Congratulations. I'm sorry to miss the celebrations. I joined the transplant unit at the Queen Elizabeth Hospital in 1968 as the very first transplant registrar. Mr. Peter Knight was my teacher and my mentor. After my training, I returned to India in 1971. I followed my teacher's example and started the transplant program in India, and we did the first successful transplant in 1971. I came back in 1976 to spend a year of my sabbatical leave and stayed on. Having worked with live donors over 7 years, I admire them for their generosity, and they get nothing out of this except emotional satisfaction. I want to make the donation easier on them. In 1993, CT angiography was one of the emerging new technical advances. We didn't have the facilities at the Queen Elizabeth Hospital, so we did the assessment in the private sector with no cost to the patient, no cost to the unit, and we introduced the CT angiogram in place of the interventional percutaneous renal angiogram. Our unit is the first to make this switch. In 1995, I saw on the internet that Johns Hopkins in Baltimore, USA, the surgeons there performed the laparoscopic donor nephrectomy. I was fascinated, and I thought we should have that procedure in Australia. I'll tell you the story how it started. One of the ways, the best way of starting a new procedure is to learn it from an expert, or invite him to come and help you with the procedure. That option was not available to us. I approached one of the surgical companies, Auto Suture, now called Covidian, and they donated laparoscopic instruments and money to buy the pigs. I had the support of the Department of Surgery and Professor Guy Madden. I enlisted the help of Professor Peter Hewitt and his senior registrar, Chris Hensman, and we practiced this procedure on pigs. The next step is to bring it on to the clinical scene, and I approached a donor, a mother who was giving a kidney to her son, adult son. I asked her whether I could try this procedure on her. I told her that we have not done this procedure nor seen it being done on humans, but we had a lot of experience doing it on the pigs. I explained to her the benefits of laparoscopic surgery, less pain after the operation, shorter stay in the hospital, and a shorter incision. I assured her that this procedure will be safe to her and to her kidney. I told her that if we succeed, we will offer it to every donor and we will replace the painful open nephrectomy. She thought for a little while and agreed. And I was surprised and about the confidence she had in us. We took a long time, maybe 6 hours or more, but we did complete. And we did the procedure on other donors. It became popular, and we presented our preliminary experience at the Transplant Society meeting. We were torn to bits. At that time, there was a TV program on Channel 9 called The Good Medicine, and they used to show the advances in medical treatment. They showed this procedure twice, and the public interest grew, and we had more patients and more donors coming from interstate. It has become very popular well before it was assessed. We were only 18 months behind the Americans in having our homegrown laparoscopic donor nephrectomy. Surgery is never constant. It is always evolving. We do the laparoscopic donor nephrectomy with 3 ports, 1 for the camera and 2 for the instruments. We started putting the ports close to each other and then in form of a cluster, and finally the camera and the 2 instruments through a single port with multiple channels. After the dissection, the kidney is removed through the same site. We have done 7 single port donor nephrectomies, and these are the only 7 performed in Australia. It is a difficult operation to do and to teach. The pain after the procedure is slightly better, but not significantly so, compared to the laparoscopic method. But the cosmetic result is excellent. Renal transplants started here in Queen Elizabeth Hospital 50 years ago, and I have worked in this unit for 37 years. Our unit has been a leader in this field in Australia. We have provided the best practice to our patients. Congratulations, and may this continue.